We'll quickly try to look at another issue or another deformity of the big toe. So for this deformity of the big toe, this is what is known as a hallux rigidus. Hallux rigidus. Okay. So hallux rigidus, I grew up seeing a lot of guys in my community having this, and it was normal back then, not knowing that it's a deformity. I used to have it before when I was a kid, but not that much. Do you understand? But now it has aligned again. My toe is straight. But some guys, they had exactly like this, you know. So it's a degenerative arthritis of the big toe, leading to stiffness, pain, and difficulties walking. So usually affects adults that are around the age 30 to 60. You know, so hallux rigidus is osteoarthritis of the big toe, and it starts as hallux limitus. That's why I was telling you guys that I had it, but it was not as much as this. Do you understand? So that was actually hallux limitus. So proper alignment, wearing good shoes, it realigns back. But as the condition deteriorates, it becomes hallux rigidus. So it could be due to degenerative wear and tear of the cartilage joints, could be genetic. So all those guys that I knew when they had this thing when I was a kid, the elder brother had it, the senior brother had it, their mother had it. Although their mother was a divorced woman, so I didn't know their father. Do you understand? Previous injury to the big toe, structural abnormalities, inflammatory conditions, you know. So symptoms is there's pain and stiffness in the big toe, there's swellings and inflammation around the joint, difficulties bending the toe upward, bone spurs may form. You diagnose just from physically looking at the stuff, you know. X-rays to also look at the extent of damage and all of that, you know. So non-surgically, just be wearing good shoes. Like for me, I used to wear good shoes at that time. I didn't actually know it to be a deformity, but coincidence just made it that I used to wear good shoes that time, you know. So orthotics, and I grew now, I'm not seeing it, you know. Orthotics, medications like NSAIDs if there's pain and inflammation, surgeries like chilectomy, arthrodesis, and also joint replacement surgeries.